An upward trajectory. We're not talking temperatures. That's how Governor Asa Hutchinson is describing the trends that we are seeing in today's COVID-19 numbers. 2,414 new cases reported today, the highest one-day jump we've seen since September. Active cases in the state are less than 300 away from topping the 12,000 mark again. And our hospitalizations made a significant jump as well. 570 people battling the virus from a hospital bed, 51 more than yesterday. 16 more deaths added to the state's tally, which now sits just below 9,100. And so while cases continue to climb, the CDC put out new quarantine guidelines for those who test positive or are exposed. It suggests cutting the isolation period in half. TH11's Mercedes McKay breaks down what you need to know.
That 10 days of quarantine is something that many people have stuck in their brain now after dealing with COVID for over a year. But now that number 10 is down to 5. Health experts say it's because data shows that most transmission happens early in infection.
Most of the data that CDC is basing this on is data that's emerged, that's evolved over this last few months.
New guidelines for a new dominant variant.
It would not do us any favors to treat this Omicron variant as if it were the Alpha variant, for example. Then we would be in really dire straits if we did that.
For people who are infected, the CDC cut down isolation restrictions from 10 days to 5 days. Once those 5 days are over, if you have no symptoms, you can return to your normal day-to-day, but wear a mask for the next 5 days.
Those people that are still having symptoms, if they're still having fever, then they should isolate for longer.
The guidelines for people who come in contact with COVID-19 but are not infected depends on vaccination status. If you're boosted, you don't have to quarantine, but wear a mask for the next 10 days. If you're not boosted, you should quarantine for 5 days and watch for symptoms. Dr. Robert Hopkins with UAMS believes everyone should test at the 5-day mark.
Part of the reason that it's not been emphasized more is we've got lots of testing holes. There are a number of testing sites around, but they're not necessarily open 7 days a week.
Dr. Jennifer Dillahay with the Department of Health believes the new guidelines were not only based on science, but also practical reasons.
In order for businesses and many organizations to continue to function, the adjusted guidelines for this particular variant would assist them.
While it may be hard to get used to, Dr. Hopkins says people should look at this change as a positive one.
As we learn more, as we're able to make more accurate predictions, as we know more about the performance of medications and vaccines and what the virus does, that gives us better tools in the toolbox down the road.
In Little Rock, Mercedes McKay, THV 11 News.
Mercedes, thank you. Both Doctors Hopkins and Dillahay say that with Omicron spreading rapidly, now is the time to get vaccinated and boosted.